Well, my presentation is going on smouldering multiple myeloma. This is early multiple myeloma. Multiple myeloma has not given symptoms yet. Up to now, differently than other cancers, we haven't been treating those myelomas until they gave symptoms, but there's enough evidence right now to make early treatment and avoid the appearance of all these complications. What's not so clear is what's the best treatment for this kind of patients, and that will be part of my discussion. Several trials that are trying to focus on smoldering multiple myeloma options. Basically, well, there's several trials, but basically there's two kinds of trials which are important. Those that are focusing on a very mild treatment with very few side effects and that you can do for a long time, that are trying to delay the appearance of symptoms, but not curing. And then there's the other option, which is doing a highly intensive treatment in order to cure the disease at its early moments before it gives symptoms. Of course, these two options are completely different in scope and intention, and we don't really have the data to say which strategy is better. Yeah, of course, tolerance of the patient, age, comorbidities, performance status. Of course, a very intensive treatment is only an option for very fit patients. But most of these patients are fit because they haven't given symptoms yet. So unless they are very old or they have several other diseases or several other conditions, that would be a good option. Well, we always try to do things in a personalized manner, but sometimes it's not that obvious. In fact, treatment for myeloma is not personalized in general because we have the best treatments that are the best for every patient. We don't have subgroups of patients that go better with an alternative treatment. So the options we have is just, as I told you, either you give a very mild treatment for the patient that is not fit enough to have a more intensive one, or you try to do your best with the best treatment available. Yeah, they are. But regarding treatment and personalization of treatment, prognostic factors only tell you how difficult it will be to treat that patient. It's not going to direct you to a specific treatment. So the best available treatment is the best treatment for any patient, regardless of prognostic factors. Well, of course, we've been heading to combination treatments with high intensity at the beginning and with maintenance treatment to continue further on, probably for years, in order to achieve probably a curation of a proportion of patients. Up to now, myeloma is not curable, but we have evidence that if we treat myeloma enough, there's a proportion of patients that will never relapse or will relapse in many, many years' time. So, of course, we are trying to improve treatments a little bit more in order to have a curable option. It's a field that's moving very fast, so we were somehow reluctant to talk about curation in myeloma because we know that the relapses can happen 10 years after or 15 years after a good response. But of course, we have to start to think that that's an option, and if that's an option, we have to try to improve. We have lots of weapons we can use. We only have to look for the best combination and the duration and how we have to use them in order to cure.